For many patients with chronic non-cancer pain, the primary benefit of continuing opioids constitutes of avoiding withdrawal. This is in fact harmful, but it's easily misconstrued as a type of benefit. Tapering opioids does tend to reduce this harm, and it can also reduce other harms such as respiratory depression from unintentional overdose, worsening sleep apnea, falls, fractures, osteoporosis and other endocrinopathies, and of course reduces their risk of death from all causes. It may also improve the patient's pain because tapering of opioids that are no longer working very well, particularly strong opioids, will tend to reduce the opioid-induced hyperalgesia, which exists in at least 80% of long-term users as far as we can tell. Talking about tapering can be a challenging conversation, particularly if you weren't the person who originally decided to start the opioids and you never were able to be there when an exit strategy was articulated. These patients are often called legacy patients, and we have an ethical responsibility to manage these patients well because they're essentially victims of iatrogenic harm. But on the part of the patient, whenever there's a discussion about reducing doses, that can certainly lead to fear and defensiveness and resistance, and that's understandable. It can happen, for example, if you know that it's the right thing to do in your belief, but the patient has not experienced that, and they don't see the case, if you like, for doing it. If they don't feel ready to start tapering, it will never succeed. It can also happen if you've been providing education about tapering without first checking in to see whether the patient's happy for you to give that information. And it's best raised as an option when the patient is expressing some ambivalence about the situation that they're in with their medications. Addressing the ambivalence enables you to articulate both the pro and the con arguments regarding their opioid use in a non-judgmental way. And ultimately, the decision to taper has to be actually left up to the patient to leave. But you can let them know that if they decide to taper, that you're willing and able to help them do it in such a way as to address the concerns that they have about withdrawals, and also to reap the benefits of reducing their opioid hyperalgesia and sedation. Once the patient has expressed an interest and an agreement to taper, then you can collaborate on a tapering plan. And you need to agree on the rate of tapering, whether it needs to be done quickly or slowly. There are times where you would do both, often not in the same patient, but a patient who is significantly physically dependent and has a significant amount of motivation may wish to just crash through withdrawals and put up with it, and they will be very pleased to do that. Other patients need to be connected with the idea of a long, slow, steady taper that reduces the risk. But you need to also agree on regular monitoring, and you need to agree on what success looks like. And in fact, my standard advice to patients is that because of opioid hyperalgesia, after a couple of years, often people will be just as good on 30 to 50% of their original dose. But some of them do get right off it completely. You need to also address the patient's expectations so that they have a realistic idea of how to handle the inevitable bumps or slowdowns or times when they may get a bit of withdrawal. They need to be aware of what support mechanisms will be available to them, and also what ways you can actually help them to self-manage the withdrawals. But a review of pain management strategies and plans, such as physical and psychological approaches, will also help to reinforce that the patient is entering their taper with a full toolbox. You need to address the fear that the patients have that they will not be supported, and you need to let them know that although they will be doing the taper themselves and they will be leading the process, but you will be their expert advisor and cheerleader there, helping them deal with things that come up and helping them, reap the rewards of a successful taper.
So conversations about behaviour change with our clients or patients are difficult when we feel that we are pushing for something that the client necessarily or doesn't necessarily want themselves. So it feels difficult when we're arguing for change and they're arguing against change. Motivational interviewing is a counselling style that's been shown to be really helpful in helping clients or patients change their behaviour. So it's got a number of useful strategies that can help roll with resistance or help the client elicit or change their motivation to change. Generally, the goal is to help them resolve their ambivalence and start to change. It's a collaborative approach to behaviour change, and that we really try and work with the client knowing that they're the expert of their own motivations and their own abilities to change. I think one of the things I think is really important to remember is that change won't necessarily occur in front of you in the clinic setting, and that motivation for change comes out of an internal experience rather than because you've been told what to do.
In this demonstration, the GP uses motivational interviewing during a challenging conversation with the patient about opioid tapering. There is some progress on the part of the patient towards agreement, and you do need to be prepared that it will take several conversations to get full agreement in such a challenging area.
Now I can see here that you've been dealing with back pain for a long time. How's that going at the moment?
It's really bad at the moment, but the opioids are helping with the pain.
I'm sorry to hear that it's been bad. Can you tell me a bit more about how the pain's been affecting you day to day?
Yes, I'm losing a lot of days from work, and when I'm at home, I'm just sitting in the armchair or lying on my bed. The pain sort of prevents me from doing anything. I think I need some more opioids like my other doctor gave me when I was in pain.
Yeah, look, that sounds certainly like quite an unpleasant situation. I'm sorry to hear. You're obviously missing a lot of work and only sitting at home because of your pain. Now, I was actually hoping to talk to you about your opioids, if that's okay. Have you noticed or experienced any side effects at all?
I don't know whether it's a side effect, but I'm sleeping all the time and yet I still feel tired. I just don't have the energy that I used to have before.
You may actually be surprised to hear, but that's quite a common side effect. Is it okay if I ask you a few more specific questions about other potential side effects?
Yes, yes.
So to summarise, you've been feeling a bit more tired than usual. You're only opening your bowels perhaps once a week or so, was that right?
That's right.
And you're feeling a bit nauseous, but you're not feeling dizzy. I do remember that you also said that the opioids are helping with the pain, but you still have some pain present.
Yes.
So you think you might need some more?
Yes.
Okay. Now it absolutely makes sense that you want to try and do something to reduce the pain. Do you mind if I give you my understanding of what could be happening?
Is it that you're not going to give me any more pills? My other doctor, he gave it to me when I needed it. He understood my pain.
And look, I understand that taking more opioids, even at higher doses, might seem like one way to try and reduce the pain. But research has shown that the body and brain actually get used to the opioid after a little while. And even though an increase in your dose may help reduce the pain initially, the effect will wear off again with time. So this is called developing a tolerance. And it sounds as though you might already have some tolerance to your current dose. That's probably why you're not getting as much relief from it. The other thing to mention is if we increase the dose, there is a higher chance of side effects. So your current symptoms of feeling tired and feeling not as energetic as usual is likely to get worse, as is your nausea and constipation.
I don't want any of that to happen.
And I agree, that wouldn't be a good outcome for you. So there are other options available that we can discuss. Would it be okay if I go through those now?
Okay.
So there is another option that people in your situation have done to try and reduce their side effects and help with the pain. Would you like to hear a bit more about that?
Sure.
Okay.
Go ahead.
It actually involves reducing your opioids.
Are you telling me that I can't take any more pills?
Look, I understand that you may be concerned and worried, and I want to reassure you that any decision around your medication will be made together. Do you mind if I walk you through how we might go about reducing your opioid?
Okay.
So for many people, taking less pain medication can actually result in less pain. And you're probably thinking that doesn't make a lot of sense, but it has something to do with tolerance and dependence. Now these are big terms and I'll explain them to you. So tolerance is when you've been on an opioid for some time and your body gets used to it. So what ends up happening is you have to take more of the opioid to achieve the same pain relief as before. Now on the other hand, dependence is when you've been on an opioid for so long that when you suddenly stop taking the medicine, so say you miss a pill or you take it a bit later than usual, you start experiencing withdrawal symptoms. And sometimes that withdrawal symptom can actually be a flare in your pain. And so what happens then is you end up taking more opioid to treat the withdrawal pain. And that can keep going on and on for some time.
It's a lot to take in. I'm feeling really nervous about losing my pills. And what if the pain comes back?
I can see that you're nervous, but I'm also confident that we can improve your situation. Many people taking an opioid have been able to improve their situation, and you may be able to stop taking the opioid altogether. And if you do go ahead, I'll be here to support you every step of the way, and we can also draw on some of those other options that I spoke about.
Okay, but
I can see you're still a little bit uncertain, so I think it might be better for you to have some time to consider your options. What about if I gave you some written material to take home and have a read, and then you can come back and see me when you're ready and we can continue our discussion. How does that sound?
yes, that sounds good.
I look forward to seeing you again.